We need to create that awareness, and the religious setting should help us. Please help us, religious, our imams, our pastors, our leaders, please help us. Because at the end of the day, by the time they get to church, get to mosque, get to religious places, and start to share testimony, can a spiritual leader, can a religion leader correct that woman or that man? Because it, with that statement alone, goes a long way. You have sown a seed in their subconscious.
True.
And it goes with every woman. They say, hey, help me to thank God. Oh, the doctor said I would do this session. I pushed my baby out by myself. Thank God with me. Oh,
I delivered like the Hebrew women.
I mean, which one is Canaanite? I don't know. We need to just put this together, and you have your baby, you have your life, you are healthy.
That's testimony.
You are a good woman.
Speaking about that bathing of a thing, I remember there was this thing about they called probably all these mates of Olomitutu that don't use hot water on the baby. The mother too should not use hot water to bathe or probably do anything with the baby. How true is that?
My sister, in Yoruba land, once upon one jora for hot fermentation for the mother, and there is always a reason. I always tell my patients, please, whenever anybody tells you anything, ask them respectfully, what's the rationale, what's the reason, and they normally give these 3 reasons why a woman should do hot fermentation after delivery. 1, what's hot fermentation? That is, they will use they get hot water, point in the big bucket, get a big towel, and big mommy or grandma, anybody, when the woman gets to the bedroom to bathe, they would dip that big towel inside the hot water. It will be so hot that mama is not even able to squeeze it. She can't squeeze it. And next thing, the first time I experienced that, not me, of course not me. I'm not allowed anybody to do that. Like, never. On my hands, I was helping her to do her laundry, and I saw that big mommy enter the bedroom with her. Then I had this loud scream from my hands. I was scared. I ran inside back. What happened? What's happened to auntie? What happened to auntie? Then I heard big mommy was doing hot fermentation for her. Then I was curious. I was inquisitive. I was in secondary school. I was inquisitive. I was like, what is hot fermentation? And when I got that was what they were doing for her. Come and see. My aunts shouted, screamed. Some women would do like this. Bam, bam. They will match the hands on the wall and use that hand with oh my. Women have passed through a lot.
But they tell you this. They tell you that this is what we did.
Mama,
that made us strong.
They will not give you, there are several reasons, but these are the 3 commonest reasons. 1, they will say if you don't do that, you'll be passing gas from the vagina. 2, if you don't do that, bad blood.
Yeah, I know. I heard of that blood. Yeah.
They do this, you know. 3rd one. Okay. If you don't do that, you will not have your tummy return to the normal size. You have big tummy.
Yeah.
And I told my patients, number 1, in fact, last antenatal, I still gave all of them assignment. They were all laughing. I said, do the assignment, write it down on the platform. Let me know. When you get home, every woman, remove your trousers, remove your panties, kneel down as if the way Muslims pray. Kneel down on your fours and raise up your buttocks. Then stand up. Tell me, to all our viewers, do it too, and send your observation.
Comments.
Send it to Madam Evelyn and Madam Heritage.
Drop it in the comment section.
Drop it in the comment section. Go on remove your panties, remove everything. Go on your fours. Go straight down as if you want to bow, and stand up. As you are standing up, you may hear something like
you release gas. Yeah.
And that's the gas coming out. Why? Because our vagina does not have a door that closes it. As I am seated, if I feel the hot that, my menstrual flow is coming, if I do not get up to pack myself, I say, okay, maybe by evening I'll go and do whatever, I may get stained. But as I'm seated, if I have the urge to use the toilet, to use the restroom, okay, I need to defecate, I can control it and not go. I'll say, no, maybe after this thing, by evening when I don't want to use any other toilet, I want to use my toilet. And the brain gets that message, and the thing is being suppressed. And you will not defecate, because our anus has a door that closes it. We call it anal sphincter. You can control it. I don't want to go and use myself now. Let me hold on. We have urethral sphincter that will control it. That urine, nothing will come out until you go to open the door. But our vagina does not have it. So when anything comes, it comes out, it flows out. When messages come, it will flow out. If you like, don't go and keep killing yourself or pack yourself, you just get stained. So that's what happens. When you bend down like that and get up, you see the gas come out. That one can happen to any woman. Number 2, they will say black blood. I will tell them, you put your baby to breast. If you do correct attachment, as your for those that have nursed baby and breastfed before, immediately your baby attaches to your areola and grabs it and starts sucking, you will notice little cramps in your uterus, and gradually you will notice some things drop inside your pad, and they will come out because as your baby latches on, the message is being sent to the brain to release oxytocin that will help in make let down, and it will also contract the uterus. So as the uterus is contracting, anything inside. Wow. And they will talk about flat tummy. Let's be deceiving ourselves. Have you not seen some ladies that have never been married talk more of having babies? Have big tummy. Have you not seen before?
Yes.
They have never been married though. Big tummy.
Yes.
Now they will have to get married. They will get pregnant. The thing will balloon. And after delivery, they want to have that flat tummy they never had before they were married. But
what if those that had it before?
Those that had it before, there are several ways. I've had patient. If that patient tells you that she just finished that 4th cesarean section, you will never believe she. Tobano will be Mori. You will agree that maybe she has not given birth before. Because we talk about genetic makeup.
You're different.
We are different in several ways.
Yeah.
Yes. I've had patient right from the hospital. In fact, vaginal delivery, you will think that I beg, hope they check this woman very well. Are you sure there's no extra baby in this tummy? Vaginal delivery. And you will see some CS moms. You will see their stomach return fast. Just because of please, let's not deceive ourselves. The number of things that we can do when it comes to flat tummy, that's not why I'm here. But it is not. They know hot fermentation, all this. I will tell you, I will always tell my people, I'm a mother of 3 by the mercy of God. I've never done it before, and I will not do it. No. I will tell my patients, me, I'm not a part of the type of nurse I will say, you run you one power, authority one shame. No. Whatever I teach you is what I do. Whatever I've done for myself is whatever you can hear from my mouth. We are talking about your awareness. Please stop this. I've heard of patients that was rushed back to the hospital just because of this hot fermentation thing, and the woman started bleeding fresh. When a woman gives birth, no matter your mode of delivery, there's a big wound site inside of you, and that is where the placenta detaches from. When you do scan today, you may do scan, the baby is lying like this, baby is turning head down, baby is sitting, different forms of presentation, but placenta is attached to the uterine wall. So no matter your mode of delivery, immediately baby comes out, the next thing to be delivered is the placenta. It will detach from the uterine wall. So that site,
the wound,
which will gradually heal up. So all this unnecessary hot fermentation in the name of having flat tummy or whatever, you just see fresh, some that they are bleeding at reduced, and not just some people fresh blood. In here to carry, they have had even that one countless now that they will return to the hospital because they are perineum, the vaginal area that they sutured opened up again. Why? They did hot fermentation of the tummy, the hot water got there.
Wow, amazing. Now, you talked about PPD the other time, postpartum depression, and there's always this pressure on on mothers, new mothers or people that just give birth, to bounce back, whether from the man or from the in-laws. Now, from the man wants his wife back. He says, Shebi, you have dropped the load. You're supposed to be back. 2 weeks, 1 month, 2 months. They're like, you're supposed to be back. Why are you still? And from the in-laws, some people say, be more lazy. Like you gave birth and you're all lazy. Me, when I gave birth, the next morning, what's in Gunyo? You understand? So this pressure of telling women to bounce back immediately after delivery, I want you to touch on that, and also talk about postpartum depression for women, because I've heard several cases of women that go into depression after giving birth. In fact, there are some that also they begin to have some conditions. I think it was Simi that said after delivery she had a condition with her eyes. She was not able to see well, that she now started using glasses. There are women that their skin starts to peel off. Some start to have vitiligo and all of that after delivery. So I want you to speak to all of that. Is for the conditions after delivery, can it be managed or can it be avoided? I mean, you having some conditions, like you having issues with your sight. I think Taoma was saying she has issues, hair loss, started to have hair loss. Is it something that can be managed or avoided, or is something that, you know, if it happens to you, you just have to live with it?
Thank you. I mentioned postpartum the other time. And I mentioned the postnatal clinic. During the period, immediately after delivery, within the first 6 weeks after delivery, there are a number of things that can happen to a woman, that woman that just nearly delivered. A number of things, several. These things can actually be easily picked on time if the woman goes for postnatal clinic.
Okay.
But most of our women would not go. So by the time they are presenting in the hospital, some are already getting, the conditions have already deteriorated and something. The number of things which can be looked into and managed early enough. Some over time, like the hair loss thing, yes, some women experience it, and over a period of time, the right cancer will be given. Anyone that needs medication will take it. In fact, some could need hospital admission. Yes, please. It starts from breast issues. Breast issues can happen to women after delivery. Some will have engorgement. From engorgement, it leads to mastitis, that you have to do I&D, incision and drainage to bring out pus from that particular breast, and a number of some prolapse. I had a patient, I used to have a patient that had prolapse, uterine prolapse. She just came and she said she always feels that something is in her vagina. By the time we examined, she had prolapse because they did terrible fermentation for her. And the thing made the ligaments got weakened and their uterus collapsed. Let me put it that way, so that I can get easily inside her vagina. She was just complaining that she normally feels that something is there. By the time we examined, what did you do? She do running, and she then started describing how they did that hot fermentation for her. A number of things. So that is why we want our mothers to be knowledgeable and to know that it does not end in antenatal clinic. After the week, thank God, no, it doesn't end there, so that we can easily pick it. This postpartum depression that you talked about is very, very real. It is very, very real. And the commonest one is postpartum blues. Postpartum blues. And that one can happen from second to third day of delivery.
What does that mean?
It's like a younger sister to postpartum depression. The woman just get tired of everything. She just become irritable. Note, what she's going through at that time can make her feel that way, especially if she's not having good support system. For instance, after second, third day, the woman's breast can be engorged if you are not careful. The breast gets filled up with breast milk, and the baby cannot completely empty the milk. No matter how the baby sucks. It can be so discomforting. It can be so discomforting if you are not skillful on. That is why during antenatal we will teach you. You must not miss mother crab breastfeeding, because a number of, it's not about being experienced though. It's not about that. It is not about that at all. And so many women that always say that when it gets to breastfeeding, most time when I'm teaching and demonstrate, do as I'm doing, by the time we go around, we'll be seeing mistakes, and she's coming with the fourth baby. She's coming with the third baby. And she will say she breastfed the first and second one, but she was actually wrong with a number of things. And that aspect, that little loophole, could bring about issues in this present baby. So a number of things like that. Suppose the woman will just become irritated, and gradually you see that Makora. She's just angry with everyone. She doesn't want anyone around. The cry of the baby will begin to irritate her.
The cry of our own baby. I
am telling you, because around if it's postop patient, she's having some discomfort here and all. If it is vaginal delivery, she may have tears that we are still telling her, try to sit up. Okay, you will do sit back, you will do that. All those little discomforts. And now you're not having some in it. Nobody is bringing food on time. Can you come? Mama is. Let me not even go there, because God will have mercy on us. Because in this environment, they say they do you go to greet grandma that is hypertensive, that she even needs rest. or big sister that you cannot send on errand. They also be actually full with helpers, but they are actually not helping.
You are still the one doing the work.
I am telling you, you even want to wake up very early to prepare her for grandma so that she can use her antihypertensive. So keep her to that cool and you know, and all through the night, baby is not making you sleep. You baby release those babies. Oh, you know, one gel, and they're not in a hurry. They can stay glued to you. They don't suck efficiently, actively they can't suck actively for 30 minutes at a stretch. Is a lie. But they can be glued. You can be seated like that for the next 1 hour. And at the end of the day, gradually you start having mild headache because you're not sleeping well. And a number of things. So when the woman does not, that support thing, that's another thing on its own. Because so all those as it comes in, because postpartum depression under 1 week to 2 weeks, the woman may have it. That one becomes in fact nothing around you fascinates you. Nothing makes sense. Nothing. In fact, the woman may feel as if she's not worthy to be the mother of that baby. She's not capable to care for that. When this woman comes like, but she called come. That's how to carry the baby. Clinical. Yeah, why is this how you are supposed to do this? And this person comes and condemns. Everybody just say that. And she just feels and it's shock absorber. Yes. Some people, when they get into such negative words, it's deep, it settles there and refuses to leave.
What of those that wants to harm their babies? I've heard of people that wants to harm their babies.
You didn't hear what I just said? I said the woman will feel inadequate to take care of that child. In fact, she does not want this. The cry or the sight of that baby
irritates her.
It could be that bad.
Wow.
Yes, plus. It could be that dangerous.
What can a husband do or someone around them do at that time?
Thank you. We need to pick it early so that we can help the woman. One of the ways to pick it early is not to miss your postnatal clinic.
Okay, so in all of this, what do you think the partner, especially the husband, and probably by extension the wife's mother and the mother of the husband can do to help a woman who is going through postpartum depression?
Thank you. Support, and that support is actually broad. Psychological support, financial support, physical support. Physical support, is being seen. Of course, in African setting, we normally see that when a woman puts to bed, you see the grandma, mother-in-law, could be the the wife's mother to come around, big sister. Everybody wants to assist, around. But the truth is, are they really assisting? You may have the house full of everybody, but they're not actually helping. In fact, they are busy watching African magic, making noise, not allowing the woman to sleep. The baby is awake crying, she's trying to call somebody, but they're all busy doing another thing. The woman we need to manage herself to feed the baby. The woman we need to manage herself to eat, to bathe herself, and a number of things. The woman may still be experiencing some discomfort. There's something we call after pain. In Yoruba they call it womo. Some women experience it. That's long uterine contraction after delivery. Some women experience it for days, even after being discharged. That will place them on analgesic. It can be so terrible in some women that they want to throw away the baby. Yes, it can be that bad in some women, and some will have it lightly. So all those things put together, is the woman actually getting the right support she needs? The husband, is he very sensitive to the woman's need? Don't forget that the husband is not a woman. He has not passed through that before. Is the mother-in-law, the grandma, the big sisters that are around that have given birth that could explain something in that line. But how is the relationship between that mother, the newly delivered mother, and those people? Because it takes somebody you relate well with to be able to freely tell and explain your problems to.
Yeah.
So what's the relationship like? But the truth is, no matter what, at least you still have a measure of relationship with your husband. Is the husband sensitive to pick that? That is it. Hope the husband is not the one that will compare the wife to another wife that delivered for her.
Or compare his wife to his mother.
Big sister. Please. It's all those things need to be corrected in our men, because if the support system is sound, beautiful. Mental problem, postpartum depression, you don't stigmatize. Ìyàwó wa ma ti ya wèrè. Kí ló ń ṣe kíní nǹkan lára? Kí ló ṣe tí ò ṣe anybody rí? Rárá. Ayàtọ̀ síra. We are actually different. We have individual differences and uniquenesses when it comes to all these things. So if the support is there, they will pick it on time. They don't be like, no, this is not my wife. This woman is not feeling too good. What's happening? Oh yeah, let's go to the hospital. When is your next clinic? When is your next follow-up? When is your postnatal clinic? You will make sure, even when the woman is saying, I'm fine. You know, women, how are you now? Fine. And she's passing through a lot. How are you? Fine. Meanwhile, they find the woman is replying with, is trying to tell you, ask me more, talk more, sit down, let's talk. But the woman is saying fine. You said fine. Uncle, when your wife says fine, please carry chair, sit down. Hear her. It means, uncle, my dear,
let's talk.
There's more.
Yeah.
So when she says fine, you want to be sure that the fine is actually fine.
Right.
And okay, so that you can prompt detection, early detection and prompt presentation in the hospital helps a lot because you're able to curb a number of things. It's not everything that when it comes to postpartum depression, you may not even need medications. That what you just need is good counseling session and the health professional helping you to plan your activities out.
Yeah.
You know, they always say this statement, mother so should sleep when baby is sleeping. It's easier said than done. That is the truth. It's not, you can't sleep when baby sleeps. Sleep when baby sleeps. Babies are asleep 2. Babies can sleep up to 18 hours in 24 hours. Newborns. We even teach them every 2 to 3 hours you rock baby up and breastfeed because they can sleep that long. So you will not want to sleep when baby sleep. When Big Mommy comes from Lagos to greet you and you are not up to go and kneel down and greet Big Mommy and she's already angry that I came all the way from Benin, you are not here to greet, you know, a number of things. God will have mercy on us. So we need to be the support she needs, but we always encourage women, prioritize your rest.
Very important.
You may not be able to sleep when baby sleeps, but you prioritize your rest.
Very important. I remember that was one thing I told my friend as I was leaving. I said, see, babe, you have to prioritize your rest. It's important because I spent just 2 hours with them and I saw how she was up and doing. Because when I got there, I saw that she was peeling potato and she didn't finish peeling the till I left. She was doing this, she was doing that, I said, babe, calm down, and I know it's not easy. You want to be all of that, and she doesn't really have a support system. You know, husband's mother and is not available. Her mom, she's a teacher in somewhere. She has to go back to her work. She only came for 3 weeks and all. So, and she's a first-time mom. So imagine all that stress.
My sister, we had this baby together in our clinic. We teach men how to put their pass. Uncle, is your child? Let's learn how to. My dear. Ọmọ ẹ ti yàgbẹ́. Ọmọ wa ló yàgbẹ́ ọmọ mi kan. Ọmọ mi nìkan kọ́ mi ìdálóyún. Yes now, yes please.
Yeah.
Yes. Yeah. If that's the only thing you can do. Men can learn how to feed the baby. The woman can express. If you express your breast milk in a neat, hygienic manner, you can put it room temperature 6 hours. It's still fine. Without putting the breast milk in anything, no fridge, nothing. 6 hours. It's still good. We can teach our husbands how to do this and that so that you sleep. You can't sleep when the baby sleeps. That's the truth. But you need to prioritize your rest. We need a healthy mother to have a healthy baby. Yeah. You need to be healthy to take care of those children. Yeah. Even your family, your husband, everybody. So we need a healthy woman. We need healthy men too, so that men will not stay chemicals. But the truth is, we need a healthy woman to ensure a healthy family, smooth running of the family. Yeah. No, don't die young. Please, don't die young. Yeah. Then, lamojukulo. Learn to close your eyes to certain things. You get to the kitchen, you see the way they scatter your kitchen, your pot. Hey, pot me not to do me. No, leave them. They scatter your parlor. Maybe the place you normally don't go and step. They've stepped on it. They've done. Lamojuko, close your eyes to those things and have a good time resting your head. By the time you recuperate fully, you can attend to all those things. They are not going anywhere.
Exactly. So we are wrapping up because we are pressed for time. But I'd want us to touch on some traditional practices that you consider they're still okay that nursing mothers can do or pregnant women can go or experience. There are a lot of them that people say, oh, I can't allow my mother-in-law to do this to my child, especially when taking care of the child. When they bathe a child and they turn the child upside down, they do like bah, 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 bah. Yeah, they use hot water also to press the child's head. They say they are trying to form the child's head. They use their hand to form dimple. They say, "Oh, mommy got on a toro." All of that, and there are women that frown at that. But there are also some practices that I know you as a midwife, you talk to her and say that, okay, as a mother, you can do this, you can do that, you can allow this, you can allow that?
Yes, thank you, ma. There are actually several practices. There are some, we refer to them as harmful practices.
Okay.
There are some, they are not harmful. They are not good, nothing. They're just there. We need to strike a balance. I was asking them in the last antenatal, I was asking my patient, my pregnant woman, I said, some of you here, you've had baby boys. Some, you've already done scan, and scan has shown you that you're carrying a baby boy. It means you're a potential mother-in-law. I'm not teaching you to go and fight your mother-in-law. I'm going to be a mother-in-law someday. Yeah. So, you want to wish them what you will wish yourself. Please be wise with it. Do not fight your mother-in-law. Oh, you are just sowing evil seed for yourself. The mother-in-law does not need to run any course. It's not natural. It will happen. But we need to balance things. But eventually, my mother-in-law, my mother, whoever visitor, somebody is trying to put in harmful practices. Please speak up. Presentation matters enough. Presentation. How are you presenting it to mama? By the time mama carries the baby, hey mama, don't mommy, I don't want me. You did me a gino. That's so insulting. How will you talk to your mother-in-law like that? How will you talk to your mother? If it's even my mother, no problem. If it's my mother, if we fight, we will settle it. But my mother-in-law, madali, because now you're a mother, don't turn the whole thing upside down. Don't scatter you. You need to be wise and discreet with it. So, because the truth is, they actually they have your love at heart for coming in the first place. Yes. So, and it's whatever they know that they will give. It's whatever they have, they give. It's whatever they know that they will practice. And if you don't do it with wisdom, you'll be like, bá ṣe talk when you to feel feel but look láyé so me kilo ṣe yin eyan mo ode oni so be already tolo ba chef is your firstborn ti ti be. Have you had any baby before? And you even see big sisters that have not been married though. They are not married though. They are counseling a pregnant woman. They are counseling somebody with a baby, and they are not just because what they have had. Big mommies, grandmas say all this. So this is what we need to do. There are good practices. These good practices, please keep it. Let's keep at it with our women. Such practices, like for instance, there are some cultures when somebody gives birth. Oh, all the women there. In fact, it's as if they've made a roster, one after the other. Visitation to that woman to assist. As somebody is helping doing laundry, somebody is going to the market to buy, to shop, to cook. So different food. There's some broth, there's some pepper soup, there's some juice they blend together, makes nice meal, relaxing things. You know, there's some things they put together to make the woman bathe and all to serve as an analgesic to relax her. There's some that will do body massage. These are cultural practices that are beautiful. The woman needs all the support she can get. Mama, you see mama carry baby, back the baby, beautiful. But just note, when they're backing your baby, check the time. They shouldn't back baby for the next 4, 5, 6 hours. Some people, when somebody comes to back their baby, they're happy. Allah should body and wash soon.
Okay, so wait, backing a baby for 4 to 6 hours is
it's wrong.
It's wrong.
You're supposed to wake a newborn up within 2 to 3, 4 hours to feed. I said they can sleep for the next 18 hours in 24 hours.
Wow.
So if you continue in that manner, baby will get dehydrated. Just notice some part of the head. That's another story for another day. Let me not even go into that. But what I'm saying, the baby will be dehydrated, the baby will not grow well. By the time you take the baby for the first immunization, the second one by 6 weeks, when they do growth monitoring, just realize that the baby is not growing well.
So you have to wake a baby up every 4 hours.
You watch time to feed a baby. Motherhood is yours. After delivery, a new phase of work just begins. I always tell my women, after delivery, another phase of work begins. Is a good work. I pray you walk the walk. When you are alive and the baby is alive, you are able to walk the walk. Because nursing a child, breastfeeding is another work on its own. You check time to feed a baby. Some babies will not grant to us. Oh my gentle. Baby is very nice. Emilio, oh gentle. That baby is not gentle. The sugar level has dropped down. Hypoglycemia. Wow. The sugars, when baby is coming from, baby does not need to cry for food. The attachment is there, the cord, the placenta. So continuously, baby gets the supply it needs. But baby is out now. Some babies may not cry. And the baby is gentle. He's not gentle. He's even tired. Doesn't have the extra energy to cry. The sugar level has dropped.
Wow.
And because of that, we've seen people lose baby because of that. They say, and by the time they get it, they just say that baby is not. By the time they get sugar level, everything, and it's too late. There have been cases like that. Yes, please. So you don't back when you are backing. Yes, be thankful that grandma, thank you for backing my baby. But you check the time the baby was backed. You check the time the baby was last fed. It means a whole lot, especially in the first few weeks and months of life, when they have rapid growth, when they need. And the more you put that baby to breast, the more that helps. Let me not even go to there, but there are a number of factors that help in lactation, that helps in the infilling of breast milk. There's a rule with breast: the more you give, the more the supply. The less you give, gradually the thing will gradually begin to drain and stop.
No wonder my friend was looking at time. She was like, "Oh, this is Koto-John." I was like, what time for? I like, you're looking at time for this.
Yes,
yes. Is I know what this is Koto-John, more time to John. And it was kind of. I was surprising to me.
That is it. So for the harmful practices, now to wrap that up, okay, they will carry baby. Okay, let's say they are beating the baby. After beating the baby, you see mothers try to adjust the baby's leg and whatever, try to put color so that baby can be beautiful. All those ones are not harmful. For the sake of peace, let's balance things. Let grandma enjoy baby.
They are not harmful.
They are not harmful. This one cannot break the baby's jaw. All those ones because. Grandma came, she traveled down to take care of you. You will not allow her bond with her grandchild. Because she will become a grandma.
Yeah.
But when they do the ones that can send the baby back to grave, you shout.
Like the funny one?
Let's talk about, let me just give you tips. Like the one of massaging the baby's head. They will say, okay, baby has a if you are not careful, if you do that too much, the brain matter at that time, the skull, everything is still so fragile and succulent. There are some they will throw the baby up to shake. There's something called baby shaking syndrome. You do that, so as you throw the baby up, some turn the baby upside down. The brain matter goes back and forth inside that skull. Tiny blood vessel could be ruptured. Anything can happen. It's good to stay safe for crying out. Can we just stay safe? All those things, leave the baby. You notice that babies, they normally regurgitate, they spit in Yoruba land. Wọ́n sọ pé ó pọ̀ ó dà. Àgbàlagbà ò kì í dà. Ọmọdé ló máa ń dà. They pour. Some when they pour, you see it come out from both the nose and the mouth simultaneously. Because there's a door here. We call it gastric. What is that about? Cardiac sphincter. Here, cardiac sphincter at the upper part of the stomach. So when baby eats, the food goes down, but that door is not completely closed. So any little unnecessary shaking or whatever, the thing a little can pour. Some babies pour a whole lot. I just tell them, calm down. At some point, the thing will heal up and close up, and you even stop. Yeah, it will stop. But once the baby, you finish feeding and whatever, after a while, in the name of blessing, you turn the baby upside down. If you have seen a baby aspirate breast milk before, you will run away. You won't allow them to carry you. I'm telling you, this is what we do every day.
Yeah.
We see newborns, fresh babies. There was a 48 hours baby. I looked at that baby. I just looked at her mama. That one was even concussion. I just thought, mama, irú àgbo wo lẹ fọmọ, not àgbo ṣe fún lágbo kọ́. Irú àgbo wo lẹ fún. The mother was pregnant outside. The mother-in-law was with us. And what type of? And he said, Agboba for 48 hours baby. And they send the baby packing.
The baby died.
They send me back to where it came from. Come and see what was suctioned out. It feed up, it enter the baby's lungs. If you know your baby's, the size of your baby's stomach at birth, you will not allow anything to enter the baby's mouth except for the breast milk. If you see your baby's stomach size at birth, you will never allow anything to enter that baby's mouth except for the food. I pray they hear a number of them. So throwing the baby up, turning them upside down, it's not needed. But they will see, if the baby girl, they will shoot at the bomb and touch it. That was not harmful. Let mama enjoy. They are born, let them enjoy. But dangerous ones, there was one, she carried the baby, she dipped her tongue inside the baby's mouth.
Why?
After eating cola nut. And the mother, the mother of the child saw her, Mama, what happened? So that the baby can love me.
And
after circumcision, they got engine oil. to care for the circumcision site.
Engine oil.
They call something engine oil. She penny soil, not penny. And they put it, and as she was putting it, that thing was spinning off the baby. Mama, the thing was spinning off. The skin was split. The woman spent 7 days in the hospital based on this thing I just described. Engine oil. So when the cord falls off, they will not keep it. They will not. Some plug iron. They will not put corrosive substance and be applying it on that site. From there, kokoro enters. And a number of things happens. In numbers, there are several practices. Some are harmful. For the harmful ones, please say no. That's why most of the time when we teach during antenatal, it's the husbands that are noting this so that they can tell mommy. If it's my mommy, okay, mommy, me, don't do that for my baby. But mommy, please, I don't want it. I can say that, but I may not be able to say that to big sister, to big aunts, to grandmama, my mother-in-law, and her. So the husband can come in to help the, because the truth is all these things gradually help the woman's psyche. By the time grandma starts saying, "Kilo day, what is happening to you people? Let me, will you allow me to do this?" Gradually, the lady is gradually feeling withdrawn, feeling incapable, if they're not in Nigeria, will they take care of themselves?
Yeah.
Speak to them about financial, they will be good. But may God help us. But because all these people together can even affect the woman and post her, make her prone her to having postpartum depression.
Wow. It's been a loaded conversation with Matron Beatrice, and I love that she always puts in some stories to cushion up the points she gathers so that it can sink well, because maternal care is not just, like you mentioned, it's not just the care for the mother but also for the fetus, for the child rather. It's also for the child, so that we have a healthy mother and a healthy baby is very, very important. I don't know if Heritage has anything to ask her, because we need to wrap up.
A quick one, just one last question is that during child delivery, do you believe in spiritual attacks, and how do you handle such scenarios? But they will like, this child cannot give birth due to spiritual attack. How do you know that this is spiritual attack, and how do you work on it?
Thank you, ma. During deliveries,
yes.
Thank God you said during deliveries. You didn't say during church service. So if it's delivery, in as much as I'm in uniform, in scrubs, I'm at work, it's supposed to be medical. Okay, are you getting me? So we do the medical intervention. We don't have any, even if you feel maybe you are religion inclined and you feel like, oh, this is an attack, you don't concern you with that to the patient. Auntie, what are you attacking? That's your colleague. Concern with them. No, just do my job. If you have anything in your own heart, you can just talk to God. God, help us with this. But that's not a diagnosis. That's a diagnosis, spiritual attack. Who does that? It's not me. No.
All right, we have to go. Well, before we go, we need to appreciate Matron for coming on the show and sharing this much knowledge with us and with our viewers. It's very important that we know this. It's very, very important. So let's have our gift packs. Okay, so we are giving you this from FluxITV. We appreciate you for coming, for all of the knowledge you have shared. I'm sure I personally have learned a lot. I'm not a mother yet, but now I know that you have to start taking motherhood steps so that when you get to that point, it's not like you're just starting the journey. So thank you so much. This is on behalf of the team.
I appreciate this. Thank you. God bless you.
All right, people. We appreciate you for staying this long, and we know that you've been educated, you've been informed on different things, especially as regards to maternal care. It's very important that we take this serious, to have a healthy mother and a healthy child, and of course a healthy father, because now they go around, they bring all the money, so let's not leave them out. Justice for the men, I mean for the men too. All right, that's the show. And sure to drop your comments. If you have any questions for Matron Beatrice, you can drop it in the comment section. We'll know how to get it across to her, and she would respond. And she might also be in the comment section to answer all of your questions. Please do that. It's very important. Like they say, it's better to be safe than to be sorry. Ensure that you go for your medical checkups. Go for your auntie, for your prenatal, and for your postnatal.
Thank you.
It's very, very important. My name is Evelyn Ohiola. Until we see you next time, Heritage.
All right, thank you so much for joining us on this episode. I'm sure you've been able to pick one thing or the other because that's actually been a very, very educating episode. Until next time, my name is Heritage Adegoke. We love you so much.
Bye.